Thank you. So my talk is quite basic, and I'll be concentrating more on the IOL design, material, and rotational stability of the IOL. Does it really matters? Somebody was asking it from the audience that which lens is the best one. So if you have a very strong platform which has sort of all properties which we have discussed, the rotation free, the best quality of vision, haptic doesn't stick together, goes through one point, less than 2 millimeter incision. So let us see how the VVLX platforms comes or graduates through all these attributes. These are my financial disclosures, and I will be mainly concentrating on this VVNX platform. What it is, as you know, most of the aspheric lenses addresses only the spherical aberration. There is no lens available or platform which addresses the coma aberration, which is apparent in all the normal eyes, and it remains there after the surgery also. So it has a proprietary aspheric optic design. It has a hydrophilic activated material with a new delivery system which is very safe and easy to use. You can just inject the lens blindfolded. It prevents PCO as compared, much more as compared to the other designs available, and of course it has a rotational stability, and this is the VVNX platform. We will be discussing each property one by one. So what is this proprietary aspheric optic design? This optic in central 1.2 millimeter has a small area of positive asphericity, then a small area of negative, and then a large area of which is the normal aspheric negative asphericity of the lens. How it function is, this aspheric design is designated to minimize the impact of coma on the image quality. The central 1.2 millimeter zone, it produces a plus coma in one direction, and the second part, which is the annulus of 1.2 millimeter, it induces coma in another direction. And when both combines, in case of decentration of the lenses, as we all know, all lenses doesn't center in the back. There is a angle between the visual and the optical axis. What it does is it improves the quality of vision, leading to a almost round point spread function, and this is evident in literature way back in 2018. This is a lab study which compared these three IOLs, the most common one, the Hoya, the Zeiss, and the Alcon, and it showed that the little decentration in these lenses decreased retinal image quality, least in the Hoya VVNX IOL, VVNX platform. But this is an experimental study where everything is aligned on the optical axis, but there is no clinical proof to it. And this was also proved that the VVNX IOL platform resists coma to a greater extent as compared to the two other IOL. As you know, as the decentration of the lens increases from 0.4 to 0.7 millimeter, the amount of coma induced also increases, but it is much less in VVNX platform. Also, the quality of vision decreases. The visual stereo ratio, which is the best indicator of quality of vision, it decreases least with the VVNX platform as compared to the other two IOL. So these are the two proofs where we compared this platform to the other two, Alcon and the Zeiss platform. These are published studies. This we published in 2021, this in Indian Journal in this year January. What these studies says that again with the VVNX decentration, actually there was an improvement in stereo ratio, which as you can see with this, it is decreasing. As the decentration increases, the visual stereo decreases, but not so with the VVNX platform, and same is true with the techniques. Those are decentration of techniques, as we have heard from the previous speaker. The decentration in case of techniques is much less, but it has a large asphericity 0.27 plus, because decentration is also leads to more deterioration of quality of vision if asphericity is more, which is more so in techniques. So with VVNX there is much less deterioration as compared to this thickness platform where the deterioration of quality of vision is much more. So this we, Parul has already highlighted, this is a very good multi-stud injector, as you can see, which has very controlled delivery of the lens. As you can see, either you can do a direct implantation, there is a small ridge, you can increase the length. The Dr. Parul showed the direct implantation, but you can also do a wound assisted implantation of the lens, and it goes through almost 1.8 millimeter incision, and there is no distortion of the wound. So this is the direct implantation, and there's a ridge. You can push it front and back and do your implantation accordingly. And it has a material which is almost all advanced IOL now, a glistening free material. So let us not go into detail, but it has a more square edge as compared to the other things. It has almost 90 degree, or the square edge is much more in this lens as compared to the other lenses. And along with this edge design and hydrophilic, this has a posterior surface which is ozone treated, and it becomes much more tacky material, and it also prevents the migration of epithelial cells behind the square edge, as well as posterior surface treatment. So this is what already a previous speaker has highlighted. It has textured rough haptics along with there is this is the textured haptic along with the frosting, which is the rough side, which increases the rotational stability of this lens. And also now the edge of the optic is also frosted, which also to some extent may prevent positive or negative dysphotopsia. So as far as rotational stability is concerned, Dr. Ramamurthy has already highlighted these lenses have all very good rotational stability, and in comparison this platform was again quite good. And over a period of time with this Vivinet platform, we have different types of monofocal, enhanced monofocal and multifocal IOL available on this platform. And recently this Impress was introduced, which Parul highlighted in her presentation.
Dr. Jain.
So this is the conclude.
Yeah.
So we have this is the only lens which has an advanced optic which try to neutralize coma and try to negate the effect of decentration on quality of vision, and rest of the points already highlighted. So that's about this platform, which stands out as compared to the other platforms in a way that it has a very proprietary aspheric optic design. Thank you so much.
Thank you, Dr. Jain.